Is there a difference between physical and mental pain? Well, Dr. Abraham Rivera from Florida Pain Relief Group joins us today to tell us more. Okay, I'm hooked already. Physical versus mental. What are we talking about here, doctor?
Pain is a cortical experience. We cannot experience pain unless we have emotion associated with it. So you have pain, and then there is a suffering associated with the pain. In fact, we have drugs that dissociate one with the other. But there is no such thing as one without the other.
Okay, wait a second here. So you're telling me that anytime we're in pain, it's because of the emotions and the mental aspect?
No, it's the other way around.
Okay.
There is always going to be an emotional component to the pain. And sometimes that emotional component is more important than the physical pain. We all seen it. Your little daughter trips on the toy and she's crying her tears out. And you see her face blushes and her world is collapsing just because she have a boo-boo, right? So there is an emotional component to it. You cannot dissociate one from the other. And it's very important as we are clinicians to listen, acknowledge, and try to treat both. On the other side, there is no such thing as mental pain by itself. You know, every time I hear that, I get the feeling that we're not really understanding the patient. Like I told you before, tell a woman in labor that that is only in her mind.
Yeah, that's what he tried to tell me, and I said, anyone that tells me that when I'm popping out my kid's gonna have a whole other story if they tell me it's mental. How are you? I like that you do say acknowledge, though, because that's what we kind of are joking about right now, but it is got to be key for you to acknowledge that. How are you able to do that as a physician?
You know, you cannot learn that in medical school. That comes with just being a human being and being in touch with your own emotions and being an understanding, empathetic, that we are human beings. Pain is a cortical experience, and pain is there to create a mechanism of defense so that we defend ourselves against harm and injury. And every time we do that, there is an emotional experience. That's why we cry. That's why it hurts. That's why we don't avoid pain. The suffering associated with it, however, can linger much longer than the actual physical injury. And you'd be surprised how often I hear people in the office telling me about how painful it was the experience that they had, even though the injury is long healed. And here am I talking to this patient, and all they want to express to me is how much did they suffer and how they were not acknowledged at the time.
Which is obviously very frustrating, even when we were joking about that aspect. So how are you able to set yourself apart, being part of the Florida Pain Relief Group, as far as when patients come in and to talk with them and to ease them?
We listen, we understand, and then we come up with a therapy design around that. A lot of times it's cognitive therapy, a lot of times it's medications, and a lot of times is trying to have that patient see how they looked back then and how they look now, and where was the progress made, and how are things changing, and then they can project what's going to be the next step.
Wow. Okay, I would say what an interesting topic. When I saw the topic, I wasn't sure how it was going to play out, but it absolutely makes sense. Well, thank you so much, doctor. We really appreciate your time as always. And if you have a few more questions or in a situation that you think our doctor can help here, well, just give them a call at Florida Pain Relief Group, which is 844-KICK-PAIN, or of course, check out their website at floridapainreliefgroup.com. Appreciate your time.